There is a moment that happens quietly inside your body after 60, and almost nobody is ever warned about it. The same pill you've trusted for years, the one that never gave you a problem, can suddenly start behaving like a completely different drug. Not because the medication changed, because you did. And by the time most people notice, it isn't a warning sign anymore. It's the event. A heart attack, a stroke. Something that felt like it came out of nowhere but didn't. Today I'm walking you through 5 medications that millions of people over 60 take every single day, often without ever questioning them, that have been quietly linked to a rising risk of cardiovascular events. One of them is sitting in almost every medicine cabinet in the country right now. And the one that surprises people the most, I'm saving for the very end, because once you hear why, you'll understand exactly why nobody talks about it. I'm Dr. Susan Sevelt, and on this channel, I take what's actually happening inside an aging body and turn it into something you can use, not something that scares you. Stay with me through this one, because what I'm about to share isn't something your pharmacist hands you a pamphlet about. Before we go further, if this is the kind of thing you wish someone had explained to you years ago, follow along now, because I cover one of these every single week, and you don't want to miss what's coming next. Here's what almost nobody explains to you. Your liver slows down with age. The enzymes responsible for breaking down medications become less efficient. Your kidneys filter less effectively too, which means substances that used to clear your system in hours can now linger for days. A normal dose starts acting like a higher dose, slowly, invisibly, without a single symptom announcing it. At the same time, something else is shifting. Your arteries lose their flexibility. The inner lining of your blood vessels becomes more reactive to stress. The delicate balance between clotting and bleeding, the one your body has managed automatically your whole life, starts to tip more easily in one direction or another. So a drug that was completely appropriate at 50 can quietly become a liability at 70. And here's the part that should bother you a little. The drug didn't fail you. Nobody ever went back to ask whether it still belonged in your routine. Prescriptions get renewed for years, sometimes decades, on autopilot. Not because your doctor doesn't care, but because these shifts happen in the background, with no obvious signal demanding attention. I want you to hold on to one idea as we go through this list today. None of these medications are automatically bad. Context decides everything. The same pill that protects you at one stage of life can work against you at another. And the only way to know which side of that line you're standing on is awareness. Let's start with the one almost everyone has reached for at some point in their life: ibuprofen, naproxen, some prescription-strength anti-inflammatories. They ease pain fast, which is exactly why people stop thinking about them. You take one, the ache fades, you move on with your day. But inside your body, something else is happening at the same time. These drugs work by blocking certain enzymes involved in inflammation. That's what kills the pain. But those same enzymes also help protect your blood vessels and regulate healthy blood flow. After 60, when your arteries are already less flexible and the lining of your vessels is already more sensitive, interfering with that protective system can cause a subtle tightening of the blood vessels. That tightening raises blood pressure, and not in a way you can feel happening in real time. At the same moment, these medications affect how your kidneys manage fluid. They cause your body to retain more sodium and water. Now you have 2 things stacking on top of each other: rising blood pressure and a heavier fluid load. For a cardiovascular system that's already working harder than it did at 40, that combination matters enormously. Multiple large-scale studies have linked frequent long-term NSAID use to a higher risk of heart attack and stroke, specifically in older adults and in people who already carry cardiovascular risk factors. And here's where people get misled. The relief is immediate, but the impact builds in complete silence. You don't feel your blood pressure climbing day by day. You don't feel your arteries straining. You just feel fine, right up until you're not. Picture someone who's taken ibuprofen for chronic knee pain every single day for 8 years. Nobody ever revisited it. Not because anyone was negligent, but because it worked, and it felt routine. That routine is exactly where risk likes to hide. To be clear, this doesn't mean NSAIDs are dangerous outright. Short-term, occasional monitored use can still absolutely make sense. The risk climbs specifically with daily, long-term use that nobody ever reevaluates after 60. And if you thought that one was underestimated, wait until you hear about the second medication, because this one is even quieter and it's sitting in more medicine cabinets than almost anything else on this list. This is the class of drugs called proton pump inhibitors, or PPIs. Omeprazole, esomeprazole, and similar acid-reducing medications. They're prescribed constantly for acid reflux, heartburn, and stomach protection. On the surface, they seem completely harmless. They quiet the burning. They protect the stomach lining. What could possibly be the problem? Here's what gets left out of that conversation. Stomach acid isn't just there to cause you discomfort. It plays an active role in helping you absorb key nutrients, specifically magnesium, calcium, and vitamin B12. Long-term suppression of that acid means long-term reduction in how well your body absorbs those nutrients. Now, that might not sound related to your heart at all, but it is directly. Magnesium is essential for stabilizing your heart's electrical rhythm. When magnesium drops, your risk of irregular heartbeat rises. Calcium balance affects how your blood vessels function. Vitamin B12 supports the health of both your blood vessels and your nervous system. When all three of these get quietly disrupted over years of use, your cardiovascular system becomes measurably more vulnerable. There's another layer, too. Some research suggests long-term PPI use may affect the endothelium, the thin inner lining of your blood vessels responsible for controlling blood flow, clotting, and vessel relaxation. When that lining doesn't function the way it should, your risk of vascular events climbs. Again, none of this announces itself. No alarm, no obvious symptom. It just accumulates. Here's the pattern I see constantly. Someone starts a PPI for a few weeks of bad heartburn. It works beautifully. They feel better, so they keep taking it. Years pass. Nobody ever asks whether they still need it because nothing seems wrong. That absence of a problem is exactly what allows the underlying risk to keep building, unnoticed, for a decade or more. The fix usually isn't stop the medication immediately. It's reassessment. Is the dose still necessary? Is there a lower dose or shorter course alternative? Has the original reason for taking it even resolved? But that conversation only happens if someone asks the question. If you're realizing right now that you, or someone you love, has been on one of these for years without a single check-in, I want you to do one simple thing after this video. Write down the question, do I still need this at this dose? That's it. Bring it to your next appointment. And if you want me to keep walking you through medications like this one every week, stay subscribed because we're about to go somewhere even more important. This next class of medications interacts directly with your nervous system, and the way it affects your heart is something almost nobody connects. These are benzodiazepines, diazepam, lorazepam, and similar medications used for anxiety and sleep. They're effective. They calm you down fast. They help you sleep when nothing else will. For a lot of people, especially later in life, they start to feel like a necessary support system. But here's what's happening underneath. Benzodiazepines act on your central nervous system by slowing brain activity. That's what creates the calming effect. But that same slowing touches other systems too: breathing, reaction time, coordination. As you age, your body becomes more sensitive to these medications. They stay in your system longer. They accumulate more easily. The sedating effect grows stronger even at the exact same dose you've taken for years. Here's where it connects to your heart. As sedation builds, people naturally move less. Less activity, more time sitting or lying down. And circulation depends on movement. When movement drops, blood flow becomes less efficient, the risk of clot formation rises, and oxygen delivery throughout your body becomes less optimal. There's a second layer that's even less talked about. These medications can affect your breathing patterns during sleep, contributing to shallow breathing, or worsening existing issues like sleep apnea. When your oxygen levels dip repeatedly through the night, even slightly, that puts real, measurable strain on your heart, night after night for years. Now stack it together: reduced circulation, lower nighttime oxygen, an aging cardiovascular system that's already more vulnerable than it used to be. None of this feels dramatic in the moment. It feels like fatigue. It feels like slower mornings. It feels like I'm just getting older. It isn't only that. The risk doesn't come from the medication alone. It comes from taking it continuously without ever reassessing it as your body changes underneath you. Now here's where this gets even more dangerous, because the next medication is something almost everyone reaches for without thinking twice. And it's not even something your doctor prescribed. This is the category of decongestants and stimulant-like cold medications. Anything containing pseudoephedrine, found in countless over-the-counter cold and allergy products. They're everywhere. They're easy to grab off a shelf. And because nobody needs a prescription for them, they feel completely safe. Here's the mechanism. Decongestants work by constricting blood vessels. That's literally how they reduce swelling in your nasal passages. But that constricting effect doesn't stay contained to your sinuses. It reaches blood vessels throughout your entire body, including the ones feeding your heart. When blood vessels constrict, blood pressure rises, heart rate can climb, and your heart has to work harder to push blood through a tighter system. In a younger body with flexible, elastic arteries, this is usually tolerated without issue. But after 60, when your arteries have already lost some of that elasticity, that added constriction becomes far more significant, especially if you're already managing high blood pressure or taking other medications that affect your cardiovascular system. And this is exactly where combinations turn dangerous. Most people aren't taking just one medication. They're managing a blood pressure prescription, a daily pain reliever, maybe something for sleep, and then cold season arrives, and a decongestant gets added on top without a second thought. Individually, each one might be manageable. Together, they start interacting. One raises blood pressure, another shifts fluid balance, another slows the system down. Your body is left compensating for all of it at once. This is the moment that catches families off guard. The trigger event, the heart attack, the stroke, feels sudden, like it came out of nowhere. But it almost never is sudden. It's the final step in a buildup that's been quietly accumulating for a long time, one medication layered on another, with nobody ever stepping back to look at the whole picture. And now, the one I told you I was saving for last, because it's the one people trust the most, which is exactly why it surprises them the most when they learn the truth: low-dose aspirin. For decades, aspirin was handed out as a simple, almost universal way to protect the heart. A small daily dose, often called baby aspirin, was believed to help prevent heart attacks and strokes by reducing blood clot formation. And to be fair, for people who've already had a heart attack or a stroke, or who carry very specific high-risk conditions, aspirin can still play a genuinely protective role. But here's what's changed. More recent research has shown that for many adults over 60 who have not already had a cardiovascular event, the routine, just-in-case use of aspirin may not provide the protection people were promised, and in some cases, it can actually increase risk. Let's break down why. Aspirin works by reducing the ability of platelets to stick together, which helps prevent clots inside your arteries. But clotting isn't only a danger, it's also a protective mechanism. Your body relies on it to stop bleeding whenever a vessel is damaged. After 60, blood vessels become more fragile, the lining of your digestive tract becomes more sensitive, and the entire balance between clotting and bleeding becomes more delicate than it used to be. So when aspirin reduces clotting ability in that more fragile context, it can raise the risk of internal bleeding, particularly in the stomach or the brain. Here's the part that genuinely surprises people. There are two major types of stroke, one caused by a clot-blocking blood flow and another caused by bleeding inside the brain. Aspirin can lower your risk of the first type, but it can raise your risk of the second. After 60, especially without a prior cardiovascular event already on record, that balance can tip in the wrong direction, and the bleeding risk can begin to outweigh the protective benefit. That's precisely what more recent clinical guidelines have started to reflect. Think about how this actually happens in real life. Someone starts taking aspirin in their 50s, based on guidance that was standard at the time. Years pass. Nobody revisits it because it feels like a safe, protective habit, almost a ritual. But medicine evolves. What was considered best practice a decade ago isn't automatically still the right call today. This doesn't mean aspirin is bad. It means it's specific. It has to be matched to the right person, the right risk profile, the right stage of life, not taken indefinitely just in case. So here's where we bring all 5 of these together, because they all share the exact same underlying truth. The risk doesn't come from the medication itself. It comes from taking it the same way, year after year, while your body quietly stops being the body it was when you started. After 60, you're not simply an older version of yourself. You process medications differently. You respond to stress differently. You tolerate imbalance less easily than you used to. Small mismatches that wouldn't have mattered at 50 can carry real weight now. So here's what actually makes a difference, starting today. First, review your medications regularly, not only when something goes wrong, but proactively, before anything does. Ask directly, do I still need this at this dose? Has my risk profile changed? Is there a safer option for where I am now? Second, pay close attention to combinations. Most of the risk we've covered today doesn't come from one medication in isolation. It comes from how several interact, including the over-the-counter ones you don't think to mention. Third, watch for the quiet signals your body gives you. Not dramatic symptoms, fatigue that hits faster than it used to, dizziness when you stand, breathlessness during something that used to feel effortless. Those aren't just getting older. Those are your body asking for a second look. If any part of this made you think of your own daily routine or made you think of someone you love who's been taking the same medications, the same way, for years without anyone ever reassessing them, send this to them today. That one conversation, one simple question at their next appointment, could be the thing that changes everything. And if this is the kind of clarity you want more of, understanding what's actually happening inside your body as it changes without fear, without exaggeration, subscribe and stay with me. Because this is exactly what we do here. Every single week, I'm Dr. Susan Sevelt, and I'll see you in the next one.